for joining us, Emme. Thank you for coming to healthcare providers as well. You've just stepped off the panel session this morning where you were talking about data and population health management and transformation in that area. What were the takeaways from the panel this morning?
That I'm not sure that we totally know how to use the data and really turn it into effective information and knowledge. That we have a lot of it from a lot of vendors, and that we could be much more efficient in how much money we're spending on accessing our data. And I think that everybody of the panels are facing very similar challenges.
That's really interesting. So when I was researching yourself, your role at York-Presbyterian, I came across a press release about the venture fund that you guys have to invest in digital health technology. The first investment was actually to Avitsia, who sells telemedicine devices and software. So I was just wondering how you think digital technology is revolutionizing the business of healthcare, which is a very big question, I know.
Well, I think that's the best question you could have asked me. We just had our own senior management retreat this weekend. And we've the charge that by the end of this year, 20% of our visits, don't ask me how to define visits, should be virtual.
Okay.
And that we have an enormous, elaborate telemedicine program at New York-Presbyterian called New NYP On Demand. And it's our belief that it's going to change the model of care for the better. It's going to improve the patient experience. It's actually better quality. It's going to be more affordable. And I think it's going to provide faster access to care. So we are totally committed as one of our major ways of providing quality patient experience, cost effectiveness, our virtual health platform. And the venture fund is a small part of that effort. It's really the tail that's wagging the dog. But as we move more and more into virtual health, we want to make sure that we are investing in those companies that we think are going to provide the abilities to really provide those services.
Definitely. So, we have a lot of healthcare leaders here who are doing similar things, looking at the technology that will help improve patient experience, engagement. So what challenges have you faced with launching these digital programs over your career?
Well, so the biggest challenge really falls under the regulatory environment at the state level, licensing requirements at multiple state levels, reimbursement, and then trying to figure out how do you change workflows to be able to accommodate the changes that are required by the virtual visits. And one of the things that we've done is in our emergency room, we set up a system called Express Care. Patients could come in, they can, if they have level 4 or 5 diagnoses, they can have a choice between getting their care through a virtual experience or actually being seen by a doctor. If it's a virtual, they can be out of there in about 29 minutes. If it's a physician, they'll be probably 2.5 hours. We have net promoter scores of 95 for patients who are being seen virtually, and we have an age of everything from 19 to 96 that have been seen through Express Care. And that's our way of trying to not totally disrupt the normal workflows, but make it as part of an alternative experience. And I think that's going to be ultimately, I believe, regulatory licensing, reimbursement will change, but figuring out this new model of care is going to be a challenge.
Definitely. Actually, talking of working relationships, you wrote an interesting article on Catalyst, and you sort of talked about healthcare like an orchestra. So I was just thinking, how, if multiple stakeholders in healthcare are coming together to deliver one standard of care, how do you leverage the expertise of many to make sure that you're delivering personalized care? That seems like a very difficult challenge at the moment.
to deliver. So explain a little bit more to me what your. No matter what we do, there are multiple people that are delivering care to the patient. So are you asking the question, is it more difficult if it relates to precision medicine, or is it?
I mean, the article in particular talked about how you guys actually brought an orchestra
We did.
into New York Presbyterian and looked at how those 90 people came together to deliver.
So it's actually all about teamwork, and it's all about respect. And because it takes so much coordination and teamwork to provide care, the idea behind the orchestra is, if you listen to an orchestra, there are frequently 20 different instruments that are all playing different parts of a concerto or of a symphony. And you can, if you listen to them play, if they're not playing coordinated and listening to each other and timely and collegially, it sounds pretty awful.
Yeah, very true.
And so the idea behind having this orchestra was to have the winds and the horns and the drums all showing us how important it is to work seamlessly together, which you can apply to everything that we do at the hospital. And it was, I think, what was really fun is we got to sit with the members of the orchestra so that you could really feel you were a part of hearing the difference in the musicality.
I think it's such an inventive way to look at it, really do. It was fantastic. I was reading about it. So how has New York Presbyterian's relationship with physicians, academics and students at Columbia and Weill Cornell, your two academic partners, helped to shape your innovation strategy?
That's a great question. We just had a discussion that we are just beginning to take advantage of the enormous talent and creativity of our residents and our young faculty. And we are just launching what we call our LEAD program, which is a young attending development program that on the one hand will teach young physicians what they need to know about hospitals and teamwork and leadership and financial and statistical skills as it relates to running a hospital. And on the other hand, they will be able to tell the incredible knowledge that they have of having worked in the interstitial cavities of our hospital and be able to provide us with how we can improve the delivery of care through the vision that they bring. And it is remarkable how we haven't taken as much opportunity to have them share with us what they know, because I think we have thought that they're busy doing what they need to be doing instead of asking them, you know, they feel sometimes they're a decoration on a committee instead of being an essential member of the team, because I don't think we've done as good a job as we can to incorporate their talent. So it's one of our major initiatives for this year, and is to improve our engagement with our entire medical staff.
Oh wow, that's really
so
interesting.
The timing of your question,
very, wow.
you're batting 3 for 3.
So actually talking about, you know, how you leverage your partners, and when you're looking at, you know, making change across an entire health system is a huge job. So how do you ensure that this change is sustainable across the entire system?
Well, I think it's all about the leadership.
Yeah.
Ultimately, it's about the leadership, and it's about the consistency in the words that are said and the actions that are done. And I think that it's too early to tell whether the changes are sustainable. We're 20 years into our merger, but I think if you look at the achievements we made to date, it's pretty remarkable, bringing 2 cultures in. We've now added 4 additional hospitals over the last 3 years, and we need to bring them into our culture, and we need to improve our own culture. So, but I think the priority of really trying to achieve #1 in the country is what our vision is. And I think that we've assembled a pretty remarkable team that, and great leadership that we should be able to do it. But recidivism is a constant threat to our achievement.
Of course. Actually, talking about priorities, you made a very interesting point in the panel. We were talking about, you've got your patient engagement priority, your physician engagement priority, there's, cybersecurity coming up at the moment. How do you prioritize out of all of the different elements everyone's talking about?
So I really do mean, I mean it when I said it. If you look at our priorities, with the exception of our culture of respect, which is definitely new, you'd see that the order of the priorities might have changed a little bit, but quality, patient experience, efficiency, access, you'll see that many standardization, financial health, they're not that different. They might have different weights than they've had in the previous, but how we want to do it is what really we're focused in, is that we want to go back to it. We want it to be through visualization. We want it to be through leadership development. We want to be through physician leader development as well. So I think it's how we're going to achieve it is what's changing, rather than the priorities in and of themselves.
Makes a lot of sense. So just to finish off, I wanted to ask you a couple of questions about your time at Healthcare Providers Transformation Assembly. So firstly, what was the biggest benefit to coming to Nashville the past couple of days?
I think that the people that I've met here are uniformly intelligent, thoughtful, and extraordinarily pleasant to be with.
Oh, that's lovely. That's very nice. And one last question. What has stood out to you about this event in comparison to other events that you've attended?
It's small and it's extremely well organized. And it, I would be honest to say some of the sessions were better than other of the sessions. But in totality, it's a tremendously well put together and thoughtful group that you've assembled.
Great, thank you so much. That's amazing. Thank you.